uh, one, of, one of our task forces. And all right, let me start over because we just started now recording. So let me start over. My name is Darcy Reisman, and we're going to be presenting the first in a multi-series webinar series, One Vision, Many Paths, Advancing the Culture of Scholarly Inquiry Across Physical Therapy Education. So tonight is the intro session. We're super excited just to be introducing the work that one of the task forces for the Institute for Scholarly Inquiry here at ACAPT has been doing over the past almost 2 years. And then each webinar series after this will introduce and explain to you what's going to happen at the end of today's talk. So today's session is the introduction and overview of the vision statement and the assessment guide that the Institute has created. So before we get any further, I want to just start out by introducing the people who are going to be today's speakers. My name is Darcy Reisman, and I was a member of the task force when we created the vision and the guide, and now I am also a vice chair for the Institute for Scholarly Inquiry. Next, we have Merrill Landers.
Hi, I'm Merrill Landers, and I am also part of the committee and glad to be here today.
Next is Stephanie Miller.
Hi, good evening. Also been part of the committee the last couple of years, and welcome.
Elka.
Hi, I'm Elka Schomburg. I too have been part of the task force since the development of our vision statement, and I'm happy to have you all here tonight.
Kelly.
Yep, and I'm Kelly Westlake. I've been part of the task force since it started as well, and I'm a professor at University of Maryland, Baltimore.
Awesome. And Dr. Rich Souza, who is the chair of the Institute for Scholarly Inquiry, won't be speaking today, but he'll be joining us to help answer questions at the end as needed. All right, so let's just jump right into it. So this is the outline for tonight. We just finished our introductions. We're going to frame the challenge that we were given to solve at the Institute for Scholarly Inquiry when the Institute was first founded. We're going to talk about the development of our ideas for how to address that challenge, starting with the vision and the development process of the vision. Then we're going to talk about the vision statement. And then we're going to talk about our assessment approach for the guide that we developed to help folks assess the scholarly inquiry culture at their institution. And then we're going to end with Q&A. So I want to start out by framing the challenge. So one of the things that we all, I believe, understand is that rigorous scientific inquiry is really an essential requisite for advancing physical therapy. And we know that research is necessary to help solve some of our profession's most pressing problems. For example, low reimbursement rates, the debt to income problem, which we really thought of in our task force as being intimately related to low reimbursement. Because of course, the income side of the equation for physical therapists is tied to reimbursement. And then of course, research is really important for continuing to enhance our credibility, not only with the people that we serve, but also with the other disciplines with whom we interact in the healthcare sphere, as well as policymakers. The Institute for Scholarly Inquiry, with this in mind, was charged to cultivate a culture of scholarship and research among physical therapy programs. So in this endeavor, we're going to talk today a lot about the vision that the Institute created and the assessment guide for assessing scholarly culture at your institution in preparation for helping you figure out how you and your institution can contribute to the vision. But I want to just point out before we embark on talking about all of that work that ISI leadership partnered with the Academy for Research, because in the process of the ISI doing this work, the Academy of Research was also helping to craft and support an updated APTA position statement on research that was passed by the House of Delegates in 2025. So we think this is just an outstanding time to really be diving in and addressing this major issue in our profession now, which is how we can cultivate a culture of scholarship and research amongst all of our programs across all of our profession. So with that, I'm going to turn it over to Elka, who's going to be talking about how we went from these ideas to our vision statement and the development process.
Okay, so thank you. Darcy, would you mind just advancing the slide? All right, so at ELC 2023, a call was put forward for educators who would be interested in joining a task force that was looking specifically at advancing research culture. So 12 educators stepped forward, and they were from institutions with diverse Carnegie classifications. And we set forward with the purpose of providing PT programs with the tools necessary to not only establish, but potentially improve and then sustain a research culture. Hold on just a minute, but that's okay. Okay, so early in the process, we met on a number of occasions, the 12 of us, and early in the process, it became clear that what we really needed before we started to develop any tools is we needed some sort of unifying aspirational vision statement that would guide this work. All right, next. So that initiated the vision development process, and you can click through this whole slide here, Darcy. Yeah. So basically what we did is we decided this 12-member group that we would divide into two 6-member groups. And within those 6-member groups, we would have diverse representation of educators from different institution types. We decided that we would meet individually, these two 6-member groups, and we would try and create an inclusive and accessible and aspirational statement that would guide future ACAPT research culture-based initiatives. So we worked within these small groups. Once a month, we would come together and meet with a larger task force. The work we did was separated. However, we did not sort of cross-pollinate. We did not share ideas when we came together as a larger group. Those groups were intended more for getting some clarification. All right, you can advance to the next slide. So we worked from April to July, and by July 2024, and you can advance, both subgroups had developed two separate vision statements. So we came back together in July, and over the course of a meeting session, we produced one unified vision statement. And the decision was made in that meeting that we really needed to provide some definitions that would improve clarity and accessibility of that vision statement. So then that led to the second phase. We created two separate task forces, and you can go next here. The first task force was charged with refining that vision statement and developing definitions. And the second task force was to explore what types of implementation strategies we could possibly create to really advance that vision statement. Next. So then that led to the second phase. So we worked from July to fall of 2024. Our two separate groups worked. One group continued to work on the vision statement, the other on implementation strategies. We took those concepts then to ELC 2024, and we presented the vision statement, and another group presented some basic tool ideas that they're going to talk about in just a few minutes. To two groups of educators. Each group was comprised of about 20 educators. And again, we had nice representation from different institution types. What really came out of that meeting was everybody was in agreement that we needed some type of vision statement that was directed at the importance of the production of impactful scholarship, that was really needed to advance physical therapy practice. And then all agreed to improve accessibility of the vision statement, that we would need supporting documentation that would include definitions. So then that led in December of 2024 to the drafting of a white paper that would disseminate then this vision statement. Next. So throughout this entire process, we had diverse representation from different institution types. The process was iterative. We were constantly seeking feedback, not only from the other task force, but also from the ACAPT board and from educators at EOC. And we were collaborative across all phases. So over the course of this 20-month process, what this really facilitated was the development of an inclusive and accessible vision statement. That collaborative process that we used to create this vision statement really modeled inclusivity by ensuring that the voices of representatives from different types of programs, ranging from teaching focused institutions to research intensive institutions, that would really be visible in that final vision statement. And then finally, by incorporating feedback and input from educators from programs that were at various stages of program development and had varying levels of scholarship productivity, we worked to really, it was that process that really sort of supported that vision statement becoming more accessible. It was aspirational, but accessible. So now I'm going to turn the floor over to Meryl, who's going to share the vision statement.
So the culmination of all of that discussion and all of the feedback was this vision statement. This would be our aspirational North Star, something that all programs could rally themselves around and align with. And so the statement is this: PT programs will produce impactful scholarship through rigorous scientific inquiry that advances PT practice and enhances the health of individuals and society. You'll notice there's a QR code on this image. That QR code will lead you to the white paper. Also, it leads you to the blueprint as well, which we will talk about a little bit later. So please, go right directly to that. If you cannot, if you don't have time to access that QR code, you're welcome to go directly to ACAP website. Okay, next. As was mentioned, we knew that creating a vision statement like this would necessitate definitions. Definitions of things that we thought were important and reasons why we put the words in to the vision statement that we did. So next. So the first one was PT programs. We felt like it was important to define the PT program. This includes the personnel and invested properties of the parties of the program. So this isn't just faculty. This is also administrators, it's students, it's clinical education faculty. It's the whole kit and caboodle. It's everybody that participates in a program and the infrastructure of a program that participates. And importantly, it's also important to understand that we're talking about physical therapy programs. This is not an individual vision statement for individual faculty member. This is for programs. Okay, the next was that we wanted to produce impactful scholarship through rigorous scientific inquiry that advances PT practice and enhances the health of societies, individuals and society. And you can see that we use the word impactful and also advances and enhances. And we took this definition from the literature. You're welcome to access that and see the reference to that in the white paper. But impactful is defined as having a measurable effect, benefit, or contribution to the health of individuals and society in terms of primary research-related impact, influence on different policies, health and health systems impact, maybe clinical practice guidelines, health-related and societal impact, and broader economic impact. So it's inclusive of a lot of different potential impacts. Next. And also, we wanted to add the word rigorous because it's important to think that if we're going to have impactful research, a necessary ingredient for that is research that's rigorous, that utilizes a strict application of the scientific method, that is unbiased and has equipoise, and is well-controlled. Methodology, analysis, and interpretation and reporting of results are all within rigorous guidelines. Next. And then we wanted the word scholarship to be defined broadly, to be inclusive of lots of different types of scholarship. So we used Boyer's model of scholarship, which has 4 different subcategories: the scholarship of discovery, scholarship of integration, scholarship of application or scholarship of engagement, and scholarship of teaching and learning. Next. So how do we make this vision real? I mean, this is an aspirational North Star, so we should try and make progress toward it. And it should be like a collective responsibility of all of us. And so the idea is that all of us, every program, would take purposeful steps towards the same vision. Next. and that we're growing a research culture that is worn into the fabric of everything that we do in PT education. This isn't just about faculty, but it's also about students. It's also about staff. It's about administration, and it becomes a part of our personal ethos and who we are as a profession. Next. And that we would have alignment at every level with leaders at every level pulling in the same direction, from department chairs to deans to students to support personnel. Everybody aligned, everybody working together, and everybody at every level at a university working together. And then lastly, next, together, thinking of this as our collective responsibility, raising the bar for what scholarship in physical therapy looks like and what it should look like, with thinking about rigor and thinking about impact, and not just doing research to meet a CAPT criterion, but actually doing research that has a higher purpose, something that will help benefit our profession, but more importantly, will help benefit society. We do all these things, we align all these things, and we work toward these things, we can make progress for our profession. And so I'll turn now the time over to, I believe it is Stephanie's turn.
Nope, my turn.
Oh, sorry.
So thanks, Mariel. That was great. Now, once the vision statement was written, as Ilka mentioned, it was time for us to develop implementation strategies for programs to advance the vision. And so we developed a discussion guide, as seen in the title here, discussion guide to assess and foster scholarship culture. And just as the vision statement itself went through this iterative process, the discussion guide also went through a very iterative process. And so we had brainstorming meetings within our own group and then at the focus groups at ELC in 2024, as Ilka mentioned, to identify key components for the assessment of scholarly culture. And through these discussions, the critical aspects really fell into these 5 domains seen here. So strategic alignment, support, collaboration, impact, and engagement. And Stephanie's going to go through the definitions of each of these, but what I'm going to focus on right now is the format of the guide itself. We call it the guide. So as we discussed the format, we really felt strongly about the fact that it needed to be a discussion-based self-assessment approach, in which there were a series of questions within each of these 5 domains to guide programs through reflection and goal setting. It also needed to be usable by all programs, whether they're initiating new scholarly activities or expanding existing efforts. So at its core, the goal of the framework is really to enable physical therapy programs to advance scholarly impact through systematic assessment and strategic planning. So, yep, next slide. And so here's a visual of just what the guide looks like, a kind of stripped down version of the first couple of pages. So it's actually a PDF that lives on the ACAPT website, as could be accessed through the QR code shown in the previous slide. So as you can see, it starts with a preamble of the points I just mentioned, with the exception of the vision. We do have the vision on the actual guide as well. But it's an overview of the format, what's needed for implementation, and some of the implementation steps that people can take. And so one format that we suggest is to use the form of a plan, do, check, act cycle, in which there's strategic planning, where it's specific evidence-based recommendations are made that will directly inform the strategic planning process. There's action items that can come about from the discussion, which are concrete tasks with clearly defined timelines, responsible parties, and success metrics. Progress monitoring, where there's mechanisms in place to check the progress, and then adjust or continue an implementation or act based on the tracking metrics that were defined. So next. So we're flipping page to the first page of the guide right now, and this is domain 1, which was called strategic alignment. And what we do in each of these domains is we start with a definition, and then we follow that by key guiding questions, up to about 5. Sometimes there's 5 to 7 in each domain, and each one of those questions are have a further discussion point in the appendix of that domain. And so here's the example of strategic alignment here. So the first question, do the program and institutional mission and vision statements specifically cite scholarship as a core component? So if we were to go the appendix, we can see that key question 1, and then there's some follow-up discussion questions. And so this will allow programs to just take a deeper dive into certain topics or questions that they feel that they need additional discussion to arrive at specific deliverables for their strategic planning. Next. So we also want to recognize that all programs have different demands and time available to do strategic planning processes such as these. So we wanted to come up with some suggested ways that this could happen. So one is it could be done as a intensive retreat, which is a half or full day faculty retreat for comprehensive evaluation across all domains. So it's in a single day. It could be quarterly meetings. So it could be dedicated quarterly faculty meetings for the systematic assessment of the individual domains. Or it could be done as a task force approach, where there's either a scholarship committee or task force that will lead the ongoing structured evaluation. So any one of these approaches can arrive at the same strategic plan. Next. So to maximize the value of each of the assessments that will come out of the discussion guide, we also recommend a structured analytical approach. And the one that we recommend is the SOAR. So in response to each of the questions during the discussion, programs should be thinking, what are the strengths? What are the opportunities? What are the aspirations? And what are the results that can arise from that specific discussion point? And this will promote both reflective analysis of current state and forward thinking. What we want to avoid is getting stuck in the barrier realm and the barrier cycle and not knowing how to get out of that. And so thinking in a forward direction will help achieve that. Next. So we've been talking about the strategic plan, and one thing that we thought might be helpful was a framework for prioritizing initiatives. So as programs will go through each of the domains and the discussion within each domain, the responses can be organized so that they're opportunities that will require little to no investment. Some might require moderate investment, and some might require major investment. And obviously, these are going to be tagged with a timeline. So little to no investment could be done quickly. So things like low-hanging fruit with minimal resources that are required, such as faculty time, administrative coordination, or drawing on existing institutional resources. And at the program level, some examples could be integrate scholarship discussions into annual review process, or create informal faculty writing accountability groups. And as I said, these are primarily done at the program level. Maybe some institutional level resources are required for connecting the dots. Moderate investment requires budget allocation or protected time, such as teaching releases, modest budget requirements, 5 to 25K, dedicated admin support, equipment, or software. And some examples here could be allocate seed grant funds for pilot projects anywhere from 2 to 5K, support faculty attendance at grant writing workshops. And because this requires a little bit more investment, it's going to be a mix of program level and program and institutional level. And this could be done in a timeline of up to a year. And then in the final row, we have major investments, which could be significant financial commitment, structural change, major budget allocation, 50K plus, opening faculty lines, physical infrastructure, long-term institutional commitment. Some examples here could be establish a research coordinator position or create dedicated research lab space with equipment. And so this is more so going to be drawing on institutional resources and a longer term planning of about 1 to 5 years. So next. And then the last point that we wanted to make was that ACAPT has the Blueprint of Excellence, and within that, there's the culture of research and scholarship. We wanted to make a point of saying that these two documents, the discussion guide that we're talking about today, as well as the Blueprint chapter, are complementary resources, and they can be thought of together. So the discussion guide is a framework for self-assessing research culture, and it's really helping programs evaluate where they are and charting a path forward. And the ACAPT Blueprint for Excellence chapter on culture of research and scholarship can be used to provide a comprehensive approach to assess current culture and implementing meaningful change. And here are some examples of the resources that can come out of the blueprint. So the self-assessment is assessing where you are, and then the complementary resources can offer some opportunities for moving forward with the planning. So that's it. I'll pass it off to Stephanie.
All right, thank you. Well, I'm going to go through the 5 different domains that are part of the guide, just to give you sort of a quick overview of what you can expect and how these are defined, and the primary main questions that will lead you in each domain. So the first domain you've already seen, Kelly showed you sort of what the format looks like, but an overview of that is that it evaluates the program and institutional philosophies related to research. So what are their alignments? Next. And so some of the key guiding questions we'll see in that, you've seen these previously, but really do the mission and vision statements include scholarship as part of those statements? And then if so, how are the program and institution research initiatives aligned? Are those aligned? And then also, are the program activities related to scholarship aligned with professional activities like the ACAPT vision or the APTA position statement on research? And then is there metric tracking? Does the program track metrics for research or scholarship, or is that done on an institutional level? Is somebody tracking that to be able to measure outcomes? And then the last question, and you're going to see this in every domain, is what are the program's aspirations for strategic alignment for scholarly endeavors? So each domain leads you through these questions and then sort of culminates to having you think about, okay, what are our goals related to this? What do we need to do? What are the next steps? And what are our aspirations? Next. So the second domain is about support, and it examines support systems, infrastructure type resources that enable faculty to engage in and produce lasting, sustainable scholarship. It includes supports both from an institutional level and also from a department and program level support. So it has you thinking about supports coming from each side. Some of the key questions related to support are the distinct scholarship development needs of faculty identified and addressed? So are they? And what are the availability and adequacy of research supports? And these are things like physical space, equipment, technology, the internal funding opportunities that may be available. So those are just some of the things you might be thinking about related to the key question number 2. And then also, what support systems exist to promote faculty well-being and prevent burnout? So just really simply thinking of taking that step back and thinking about what sort of supports are there for faculty, because this is challenging. Oh, sorry about that. And next, and then do workload policies, allocation, and scheduling support faculty scholarship. So that really that's sort of something we all think about. What kind of time might be built in, and how are faculty supported in that means? And then how is scholarship considered in our annual evaluation, in promotion, and tenureship processes at your institution? And then again, lastly, what are the program's aspirations for scholarship support systems? So once you've worked through all these questions, thinking about what your goals are. I don't know where those lines are coming from. So then domain 3 is about collaboration, and that's really looking at evaluating the program's ability to cultivate, align, and sustain meaningful partnerships that are going to strengthen scholarship and your research impact. And when we built this domain, we really thought about different types of partners that we might collaborate with. And you'll see them here. So we thought about clinical partners. We all have clinical partners in our DPT program. So that academic clinical relationships to support clinical education, but also the integration of research in the clinic, translating research right into practice, and then the other way, having practice inform our research design. It's about collaboration with our community partners locally, regionally, nationally, internationally, and addressing shared priorities related to health, education, and service. And then also thinking about those intra and interprofessional research networks and partnerships. So the PTA team and how each contributes within their scope of practice to research and scholarship. And then also we use the IPEC definition for interprofessionalism, thinking about 2 or more professions and how they work learn to from and with related to research and education and practice. So some of the key questions related to collaboration are things like, how are scholarly collaborative relation or partnerships initiated and nurtured? So how do we start them? And then how do we keep them going and strengthen those partnerships? Are the projects responsive to needs of each partner, the program and our collaborators? So how again, in nurturing those relationships. Next. And then what evidence demonstrates measurable outcomes? So a lot of times when we talked about this a lot, about how we may have partnerships, but how are we measuring and keeping track of those outcomes from those collaborations to ensure their success? And then what mechanisms exist to ensure that then they're sustainable over time? And then lastly, again, brings us right back to that question about our aspiration for fostering collaboration. So what are the directions? Are there already collaborations that we need to nurture and strengthen, things like that? The fourth domain is about impact. So it evaluates the program's success in generating measurable benefits for individual and societal health through several different areas: direct research translation to practice. So how are we translating that to practice and policy? Innovation to advance practice, and then also strategic dissemination across professional, academic, and public spheres. And so some of the questions for impact are, what is the impact of the program's research on practice, outcomes, policy, society? It really has you thinking broadly, not just, am I getting it published in that journal, but what is our overall impact? How are we contributing to the physical therapy body of knowledge? What knowledge translation activities could amplify the research impact? What is the program's overall approach to innovation in physical therapy research? So thinking about that again broadly from a program perspective, and then how is the program communicating, and also what is the visibility of their strategies of their research? So how are they making the public, making our profession, making students, making educators aware of their research? And then the last question again is related to aspiration. So where do they want to go related to impact of their research? And then the last domain is about engagement. So it evaluates the program's operational implementation through several different things. So it looks at engagement from just what is the clarity around expectations of engagement? Are there recognition systems related to engagement in research and success? What is the leadership's activity? And do you have a strong leadership culture around and support for research? And is it inclusive? And so some of the questions related specifically for engagement are, how clear are faculty about their role in scholarly endeavors? Next are, what are the program's leadership's perceived importance? So where does leadership fall in supporting research in the program and institution? Are there recognition and rewards that are provided for faculty related to their research productivity? What mechanisms are used to stimulate and maintain research activity for the program and faculty? And then lastly, is research and evidence-informed practice integrated into the curriculum? So are faculty taking the scholarly products that they're generating and putting it right back into their curriculum? And then lastly, then it generates that question about aspiration again. So where does the program want to go related to their engagement in scholarship? So this was just a very quick overview of all the things that you can expect in the guide. You could see the guide, you have the QR code, and you can see that these were really some of the main questions. And then for each one of these guiding questions, you can see in the appendix, there's more questions that will help you develop a deeper conversation and reflection around each one of those guiding questions.
Darcy, your mic is off.
Okay, yeah. I am not a rookie, although many occasions tonight I appeared like one. Thank you, Elka. So we left plenty of time for Q&A. because we think that is really critical for everybody to use some of the information that we're providing tonight. But before we jump into that, I wanted to talk about the future webinars. So today was just the overview of the vision with, and it has the accompanying guide, a white paper and guide, and those QR codes were in the presentation. But if you didn't get a chance to use the QR code in the presentation, please go to the ACAP website where you can find the links to both the vision and white paper and to the guide. And those are freely accessible and usable for you guys. What we're going to be doing in the next 4 webinar sessions is we're going to be taking the guide and we're going to actually be applying it to case examples for different types of institutions and programs. So the next webinar is going to be emerging research intensive program strategies and to foster transition to the research intensive culture. Then session 3 is the teaching focus programs, creating strategies to foster scholarship within mission and institutional resource constraints. Session 4 is for hybrid programs, unique challenges and innovative approaches to building research culture within non-traditional education models. And then finally, the last session in the summer will be how research intensive programs should be examining and examining their infrastructure and examples of alignment with the vision for all faculty, not just those who are doing discovery research. So those are the future webinars. And in those webinars, you'll really get an opportunity to see how the guide could be used in each of these type of programs, which we think covers the vast majority of types of institutions and programs that are represented in physical therapy. So with that, we'd like to turn it over now to a Q&A session. I know Elka has been monitoring the chat. So Elka, I don't know if you if there were some questions you wanted to start with in the chat, or if people want to unmute themselves and ask live.
Yeah, so there are no questions in the chat right now.
Okay. All right. So at this point, please feel free to unmute yourself and ask any questions. And I'm going to stop sharing so I can see more of you.
Sandra, go ahead.
Hi, thanks. So I apologize. I got on at 6:03 and I might have missed the first couple of slides. But I'm wondering whether there's been any kind of measurement or baseline measure of where we are now with programs and how that data might connect to the need for a very systematic strategy. I appreciate the work that went into the document and the questions that can be asked. I think that provides a great blueprint for any program to look at itself. But is there any background data to suggest that, you know, we're already 50% or 80% there, or only 10% there?
Yeah, Meryl, do you want to take this one?
Well, I can tell you we're not there. We can tell you that we're not there because of the value proposition for physical therapy is really struggling. We're struggling with reimbursement. We're struggling with a lot of things across the board, evidence in a lot of different areas of practice. And so I can just say that, you know, the science is advancing really, really fast, and we're not keeping up with it right now. So yeah, there is a lot of room for growth. Now, do I have a number? I don't have a number. But we do have some thoughts that we will be looking at measuring and doing a study or two here coming up in the future about measuring the impact that it has in an individual program and then over several other programs. So establishing a baseline for your program is important. But one of the things that we wanted to also highlight here is this is for every program. We feel like every single program, no matter where they're at, even the highest performing programs in our profession, we want them to improve too. So we want everybody to improve, and we want everybody to evaluate themselves using the document and then using that as a metric to see where they can make gains in their own specific areas. And so I'm kind of a little bit long-winded on this, but we have talked about doing a few studies, like implementation type studies. But the important thing here is that this is something that you can do with your institution and to find growth in your own institution. I hope did that answer your question, Sandra?
Well, it created a couple more.
Okay.
So if nobody else is waiting, I'm happy to ask them. So the first question is, are we sure that it's a lack of research and not enough put into marketing and promotion of what we already know and can do? And second, would we be better off at this point, or is it needed to me, it seems more complementary, that we really need to map the research that is going on to see where there are programs that are duplicating efforts that are not working together, but could be. Those kinds of hubs could be, instead of worrying about within institution, might be more dynamic, because then a message gets out to a much broader geographic area when multiple institutions are working on the same collaborative work, and probably works better for getting those large shrinking NIH grants.
Yeah. So Sandra, I think those are excellent points. I wanna mention, I absolutely do think that in our conversations with the APTA, and especially as we were helping to revise the APTA statement on research, what became very clear from the APTA's perspective is that while there has been some excellent science, particularly in the area of musculoskeletal disorders, if you think about back pain, et cetera, where they've really shown the value of early physical therapy over, surgery and those kind of things.
Right.
What is lacking in so many of the cases is the financial piece to the research, right? And understanding the financial impact of that. And that is why you see the Foundation for Physical Therapy Research in some of their recent calls having that the cost part of the research. Right. So certainly I think there's a lot more research to go on in that area. I also just wanted to mention that when Merrill was part of a paper that was published in the Physical Therapy Journal a couple of years ago now, really demonstrating the number of programs that are really participating in at least scholarship that's published, and it's a fairly low percentage. So I think in general, we really, as a profession, need to really help the programs that aren't doing publishable research, help them chart and navigate a path toward that, because the publication is one of the main forms of dissemination. Related to your comment about the joining of forces. So there are 2 NIH P50 grants right now that are designed to develop rehabilitation databases. So outcome databases where researchers can join forces. And one of those P50s is out of Washington University. Physical therapy is a big part of that. So if you Google Washington University Rehabilitation P50, you can look at all of the resources they have for helping to facilitate that kind of thing. But Sandra, I think you're spot on. That's exactly the kind of thing we need to be doing, which is joining forces to really have not so many individual research projects going, but some larger collaboration. That does assume that there's research infrastructure parity across institutions to some extent, right? And so I think, part of what we want to do with the guide is help people really assess their research culture and understand where they're likely most able to contribute. Some places are most able to contribute to discovery research. Other places are more more equipped to participate in the scholarship of engagement, right? And so really having institutions sort of think about where they're more able to contribute, and really then, as you said, those groups kind of aligning themselves and working together. Does that get a little bit more at what you were talking about?
Yeah, I think so. It's a big look. It's all of this is aspirational, and you're right. We need all of it. But I just didn't know if there were other activities happening with regard to maybe mapping what is happening already versus the need to kind of look within and develop from within. So
I wanted to add on this because I think this is such a good point. So thank you for bringing this up, Sandra. When we think of research, we mostly think of the scholarship of teaching and learning, but the scholarship of integration, where we take information, all the studies that are out there, and we put them together in systematic reviews and meta-analyses. That's really where we get at some of these like higher level type of evidence pieces that we can use. And so I think that's the type of research we also want to encourage, and scholarship of application, where we're doing implementation science, where we're trying to push physical therapy to really do impactful research and thinking about impactful research. And you've heard of the leaky research pipeline, where they say it takes 17 years for a study to get into clinical practice. Well, if we're efficient and we're humming as a profession, we're really doing well and everybody's on board and we're all collectively working, I really believe that we can shorten that leaky research pipeline by years and get evidence into practice faster if we have more people doing research and doing impactful research, not just scholarship of discovery, but scholarship of application and scholarship of integration. We really need people working in those areas as well.
Well, we do have that evidence to some degree that the guidelines have really facilitated changing practice. And there is data to show that from several studies, but we also have some marketing issues with not everybody in their own academy even know that they exist. So
yeah. Having toiled, Sandra, as you well know, I toiled over a CPG, and then you just pray to God somebody actually looks at it. I did also want to mention for those on the call, and then I want to follow up. Maggie has a question in the chat that I want to follow up on, but I did also want to mention that there is also a move afoot. Another Maggie, not Maggie O'Neill, but Maggie French at the University of Utah, who is really working with researchers to spearhead within the EPIC electronic health record, which is the dominant electronic health record in the large hospital systems in the United States and a lot of outpatient practices as well. She is really spearheading an effort to have standard outcomes within EPIC that we all collect, and that will really, really facilitate some of the big data capture, Sandra, that we need to really move the needle on some of this. And so I think, again, I would really encourage people, if you're in a program that is part of a medical, a hospital system that uses EPIC, working in those kind of groups also, I think, is really a way to have major impact, as you point out, Sandra, without you going off and doing your own little study. So I think that's great. Maggie, I just wanted, Maggie, you put a nice question in the chat about the scaffolding. Can you elaborate a little bit, and we'll see, and then we can talk about what we're doing, and maybe it addresses scaffolding. I'm not sure.
Yeah, sure.
And then,
sorry.
Okay. No, I was just going to say, Darcy, we should just let the group know there was a question about getting slides. That this webinar is being recorded and you will have access to it on the ACAPT website. So, okay. All right, Maggie.
Oh, thanks, Elke. And thanks all of you on the committee for this really informative and thought-provoking presentation. So my point about scaffolding, and maybe the wrong word, but it's the only one I could think of without another cup of coffee, is P grants are great if you're in a facility that can actually have the resources to help do a P grant or participate in a P grant. U grants too, I suppose, but it sounded like I was saying Hugh Grant, not the actor.
Yeah.
EU grants.
We got you. Yeah.
Yeah, but my point is, if one's in a facility that has the resources to be a partner on those large grants, that's great. So to me, it's like scaffolding and matching resource and research capacities among and with, between and within university settings to be able to have then a real spectrum of PT research, and it's not better or worse, it's just different. PT research that's at a medical center level with a large data set. And yeah, Maggie French is doing a great job. She was our research summit keynote, one of our keynotes in PEDS a couple of years ago, and that's a great idea. But that also begs the question: can you get your electronic medical records to have same structure? Can you get your university resources and office of research to have same supports? And you can't. So can we come up with scaffolding for those researchers? And I say this hesitatingly, so I apologize to all my qualitative comrades. That is a qualitative type of a research that's more application based. I'm more application than discovery, for good or for bad. And can we have a cascade of how that to create these collaborative teams that have reasonable goals that you can reach a research capacity growth. You know what I mean, Darcy?
I do. And I think this is, I think you're hitting on, and Kelly or Stephanie can jump in here too. I think this is why we really created the guide, Maggie, to really help people sort of figure out where they feel like, as an institution, where they can best contribute. And then once they've identified that, then, really understand, really then looking for the opportunities to work with folks where that can be, as Sandra said, really what do I want, the sum of the part, the whole is greater than the sum of the parts, right? So I think that might get at that a little bit, what you're saying. The other piece I wanted to mention is one of the other things that we're doing. We're running a pilot project at the ISI this year for the first time. It's actually a grant writing workshop for people who are at institutions where primarily you're going to be going after foundation funding, maybe small NIH grants. Maybe you're at an institution that doesn't really have a strong research office. And so really, we're doing the pilot program this year for the first time, and really trying to create cohorts of people that can really then, go out together and work together and have, mentorship teams, but also cohorts of people who are at institutions that maybe don't have as much research infrastructure, so then they can work together, rely on each other, also for a sort of a different kind of scaffolding. So I don't know, Maggie, if that sort of addresses what you were
I think
talking.
that really does, and I think that's great. And I'm just going to throw one more plug in because that's me. Always more than I should. Even within the study, so if my university matches someone else's university, and it's always great to have someone you're chasing too. It doesn't have to be so matched, but you want to make sure that it's a partnership. It's a
Right.
merger, not an acquisition. Do you know what I mean? So
Yep.
both sides are working. And because I am so pediatric in my bones, and Sandra knows that because I'm suffering through a CPG now, and poor Sandra's helping me. She's suffering because she has to push me through it. So thanks, Sandra. But my point is, can we think more lifespan in some of the programs that are out there? So whether
Yeah.
they're P grants or whatever, can we include a lifespan approach? That would also help to bring people in,
Yeah. It's great.
So
All right.
Darcy, we have a question from Alicia. Okay, yeah.
Yeah. Yep. I see Alicia's hand up.
Hi, thank you. This is just a real basic logistical question. The white paper mentions a scholarly assessment tool, and then we have this self-assessment discussion guide. Are those two different things, or is that one in the same?
One and the same.
Okay, thank you. And
Yep.
one other question, just based on how the subsequent webinars are going, would you suggest as a program we start addressing some of the questions in the self-assessment discussion in preparation for some of these meetings, or will these meetings be just you disseminating in applying this guide to specific kind of cases, whether it's hybrid or research intensive, or any suggestions on the timing of this and whether there's value in us initiating this sooner rather than later.
I'll answer, but then I'll let the rest of the folks on the committee weigh in I think, Alicia, first, I would say either, whatever it works for your institution. I think, if you've done some work before you attend and looked over the guide, I think you'll get more out of the future webinars. But I also think the future webinars, and I really recommend, let's say you're a hybrid program. I wouldn't think that just the hybrid program webinar would be useful. I think all of the webinars would be useful to see how this could work in different institutions. But I would think that it might also be fine if your institution hasn't done anything, and then the webinar can kind of be a jump start, right? Because it's going to kind of give you a little bit more of sort of the how-to, and ways that programs that are like if you were a hybrid program and you went to the hybrid program, you would see how they have used it, right? So I think either way could be great. We're also submitting a session for ELC, and if it gets accepted, there's going to be more opportunity to do hands-on application of the assessment guide at ELC. The next sessions are really meant to be sort of roll up your sleeve, we're going to present some cases, and then you're going to be asking questions and really kind of with an eye towards, okay, what are my next steps? Does that make sense?
Yes, that was very, very helpful. Thank you so much, Darcy. And a few of us on this call work with Maggie French, and I just also want to, sing her praises with the work that she's doing.
Maggie was one of my former PhD student of mine, so I can't sing her praises enough. Anybody else on the call want to add in and answer?
So we have Christopher has had his hand up. Christopher.
Oh, okay.
Christopher, we can't hear you.
You're not muted.
Yeah. No.
Still can't hear you.
Shoot.
While Christopher is working on his audio, did anybody else on the task force want to answer the question that Alicia had about how you think we should approach the future webinars?
I could chime in. So I think you answered it perfectly, Darcy. Like it could be done so that you're reading the guide and kind of thinking through things ahead of time. Using either, I would probably recommend it's better to do it as a faculty group rather than individually, although if you don't have an opportunity to get together as a faculty, obviously individually is better than nothing, but it's good to work as a brainstorming discussion session together to hear everybody's input. If that's not possible, then the webinars can be attended and just kind of thought-provoking, and then you could do the discussion guide later.
I lost Christopher. Did he get his situation? Christopher, is it working now? No. Oh, shucks. Can you type it in the chat? Oh, Elka, we think alike.
I know, don't we?
I know we're running out of time, but Christopher, if you type it in the chat, people who have to hop off, feel free to hop off. And those who can stay on, please do.
I guess
Anybody?
I can weigh in just.
Yep.
Let me just ask Christopher, are you typing your question into the chat? Do you want to give? Okay. Yeah, you are. Okay.
Okay. I was just going to weigh into for Alicia, just to let her know, because I, myself and Brittany Samolsky, who's somewhere on here as well, are going to be leading the next one about emerging research programs. And we're really going to be looking at it from different perspectives and providing some We're going to be answering the questions ourselves, like taking on some different questions and answering them to give you a sense of, okay, here's how we're approaching some things for some different, and then hoping that brings forth discussion from others and how others might look at it. So just to give you a sense of sort of what we've been planning and what we'll be doing here just in a couple of weeks.
Yeah, so Christopher says, will there be discussion regarding how to build a research culture when one does not exist at the institution level? I'm at a very small institution and the DPT OTD programs are the newest programs here, but lead the way in terms of published research. Yeah, so this is you exactly, Christopher. That's exactly what we're trying to get to in these conversations is, the guide is really meant to help you identify the aspects of research culture that maybe are lacking, for lack of a better term, at your institution, or that you identify as not being where you want them to be. And then the implementation piece, really talking through, and that's going to be a huge part. Again, hopefully the ELC session will get accepted. If not, maybe they'll let us do a series of webinars on it. But that is going to be the implementation piece. And I think what we're really going to be working on, Christopher, is really implementation strategies at sort of that low cost, low resource level, because that's the level at which programs and departments have control, right? And so if you're at a institution that doesn't have a great culture, really, really making sure that culture is as strong as it can be in the space that you have control of, first, and then, working forward. And so we're going to be really focusing a lot on that. Anybody else on the task force want to tackle Christopher's question?
I mean, I could just say that's exactly how the guide is created. It's meant to be all inclusive. So all the questions have been kind of dissected together just to make sure that they can be answered appropriately by institutions with just starting programs or, fully established research programs. The other thing is that the implementation table might be helpful there because there are some low-hanging fruit that could just be done, within a few months. But then there are much larger, longer timeline investments that can be made too at the institutional level.
And I would just like to say, on the task force, I'm the individual that has, strongly represented that institution type, Christopher. And so that's something that, I'll be directly addressing in the teaching focused webinar. The other thing is I have found that, attending and listening to my colleagues that are at different institutions, it generates a lot of ideas, of ways that maybe I could scale that and make that work at within our program and at our institutions. So
there's a question there from Ashley. Did you see it?
Yeah. So Ashley says, what about enhancing student involvement in research with the purpose, hopefully, of producing a downstream effect of enhanced clinical scholarly inquiry in our future clinicians? This is something we're implementing, building in our program. And so I think, absolutely, Ashley, I think what I would say there is, that whatever the research culture is in your department, that then can be scaffolded on top of, right, for really getting the students engaged, right? And so really identifying those things within your research culture that where you could really scaffold on top of that for the students. And so often, when we've been having these conversations with different programs and they're talking about student research projects, we start talking about really leveraging the things within your institution that are really strong and starting there. I think so often where some of the student things go awry is, the students have really big ideas about wanting to do small, clinical trial projects or small intervention studies. And those are really, really hard things to pull off unless you have a discovery-based research culture. So I think, doing that work to really assess your culture and figuring out where your strengths are and then capitalizing on those with the student research is phenomenal. Anybody have anything else to add from the task force on that one? Meryl?
Yeah, I wanted to add something on this. I think if your primary driver of your research culture is your student research, that may not be the right way of thinking about it, like thinking like letting our students drive our research. Actually, you maybe can use them as adjuncts or help them out, or create that culture of it. But I think importantly, we are modeling research for future generation of researchers. And if students have bad experiences and they see tired and stressed faculty members who are doing research, and they see that, they might not likely go into research. And so I think building a culture of positivity in research with our students, whatever it is, so that we can create an army of researchers going forward that really have a love and desire to do research that can help our profession. I think like thinking the big long-term piece of what involving students in our research can mean.
Yeah, really building on your strengths, not the other way around, not letting the students guide the process, right? But building on your strengths as a program, for sure.
Yeah, and we also have we have the engagement section. The domain of the guide has a question related to student involvement in research, and then there's 8 follow-up questions from that to help kind of assess and maybe think of ideas how you can better integrate research with the students.
I'm just going to take the opportunity to thank you guys for putting this together. This task force has been amazing. Darcy, Meryl, Kelly, Elka, Stephanie, Brittany, Diane, Jeff, you guys have absolutely pushed forward for a long period of time, and your salary is not that respectable. So you've done it on a volunteer basis, and I'm just so impressed with everything that you guys have done. So thank you for everything.
Thank you, Rich. And again, I so appreciate this discussion, everybody. I think, really what we want is for everybody to be able to use the guide at their institution in whatever way works for them, right? To build this culture of scholarship at institutions of all different shapes and sizes. And so we really, really value everybody's input and people coming and asking questions and thinking this through with us and being engaged participants in the future webinars and in the future things that we do. So, I think we're all going to get better together. So thank you all for participating, and hopefully we'll see you all on some future webinars. So thank you very much.
Bye.